welcome our guest speaker today. Her name is Dr. Kenia Rodriguez Spengler. She's a licensed clinical psychologist and neuropsychologist, and has been a member, you too, huh? And has been a member of the Orlando Health Neuroscience Institute since 2010. Dr. Rodriguez Spengler, her interests include dementia, movement disorders, and traumatic brain injury. She also conducts pre-surgical neurophysical evaluations for deep brain stimulation and seizures. She's participated in clinical research trials in collaboration for Parkinson's disease, deep brain stimulation, traumatic brain injury, and amyotrophic lateral sclerosis. How did I do on that? Was that pretty good? Awesome. She's a member of the National Academy of Neuropsychology, Hispanic Neuropsychology Association, the Florida Psychological Association, and the International Neuropsychological Society. Please give a warm welcome to Dr. Kenia Rodriguez Spengler.
Thank you so much. So most people don't know what a neuropsychologist is. So I'm happy to be here today and give some of that information, as well as talk a little bit about Alzheimer's. I am grateful for the invitation to come and speak with you all. And I have already met some wonderful people and enjoyed some nice conversation while I've been here. So thank you for being so welcoming. So just to tell you a little bit about what a neuropsychologist does. First you go to doctor and aim for a degree in clinical psychology, and then you specialize in neuropsychology. And what a neuropsychologist does is a little bit different than what you typically expect a psychologist to do, because you think of psychology, you think about therapy or laying on a couch and talking to somebody. But what a neuropsychologist does is that we give assessments to measure your thinking abilities. So we use a lot of different tests, IQ tests, but also tests of language, attention, processing speed, executive functioning, and decision-making to assess how a person's brain is functioning based on their demographics. So we compare an individual scores to that of other people, their same age and level of education. And our hope is always that that person will function at the same level as their peers. What we're looking for as neuropsychologists is, are a person's scores below average? And if they are, how far below average are they? And what does that mean for that person based on some other information like your medical history or information that they have provided during an interview with us? And so I do see a lot of patients, or I do see a lot of individuals who have concerns about dementia. That is probably the highest reason for referral from primary care providers as well as neurology. And so one of the first things I want to talk about, so one of the main questions that come up during a visit with me is, what is dementia and how is it different from Alzheimer's? And there's a common misconception that they are two different things. So dementia, the definition is a general term for a group of conditions that cause a decline in thinking, memory, and reasoning abilities that can interfere with daily life. So I said there, right, a group of conditions. There are several of them. Here, this is not comprehensive, but there are several dementias. Here are some of them: Lewy body dementia, which is the second most common, vascular dementia, Parkinson's dementia. The reason why they're different is what has caused the dementia. So in Lewy body dementia, for example, it is that you have an excess of Lewy bodies in the brain. Parkinson's dementia, pretty easy to guess why a person would have Parkinson's dementia. It's because they have Parkinson's disease and it's progressing to other areas of the brain, now causing dementia. What we're here for is to talk about Alzheimer's disease, which is the #1 most commonly diagnosed dementia, types of dementia. And what is Alzheimer's disease? The reason why it makes it different from other dementias is because it is an accumulation of tau and amyloid plaques. We actually all, especially as we age, have some level of tau and amyloid plaques in the brain. It is when we have too much of that that we start to see the changes in memory, language, and functional abilities. There is something called mild cognitive impairment, and I threw this in there because sometimes people also think, well, I'm aging, that could be why I'm having these difficulties, or I've heard of something called mild cognitive impairment. So let me just tell you what that is. Mild cognitive impairment is when someone starts to have difficulties in their memory, in their thinking abilities, that is not enough to affect their functional abilities. What are an individual's functional abilities? So your ability to drive, get to places that you know well, the grocery store, your sister's house, your doctor that you visit often, cook, make well-known recipes, remember to take your routine medications. Those are your functional abilities. So if someone has some decline in their thinking abilities, but it's not enough to affect their day-to-day functioning, we give a diagnosis of mild cognitive impairment. There are times that mild cognitive impairment is an early sign of dementia, so it will progress over time. Other times, mild cognitive impairment is just that for some reason, could be because of stroke or a medical condition, or just the way that the brain is changing with age, someone will develop these impairments that are just, they're mild and not enough to diagnose dementia. When there is a decline, however, in functional abilities, some of those things that I mentioned, and then there's also changes in behavior, such as sundowning, agitation, confusion, that is when we know there is certainly something else that's going on, and it is not just age-related changes. All right, so what are the statistics? I don't know how many of you are familiar with the statistics of Alzheimer's disease, but just 24 years ago, in 2020, the statistic was that about 4 million Americans had Alzheimer's disease. Does anybody have an idea or want to guess the number of Americans diagnosed with Alzheimer's disease now in 2024? 20 million? 5. So it was 4.5, around 4.5 in 2024. So it's almost doubled. It's nearly 7 million Americans are living with Alzheimer's disease today. The typical onset is, which is considered a late onset, is in your mid-60s. Typically, this is when people are retiring, right? Or they're getting ready to retire. And a lot of the patients that I see are people in their mid-60s who are noticing, you know, ever since they retired, things are a little bit different. They're not functioning as well as they used to. They don't feel as sharp. They feel a little bit of fogginess. This is a typical age that we diagnose dementia, although unfortunately, there are individuals who can develop dementia as early as age 30. Although individuals diagnosed with dementia at that age, or Alzheimer's disease at that age, is because they have other underlying medical conditions. There is a discrepancy, and I did get this this figure here from the Alzheimer's Association between men and women. Women have a higher tendency of developing Alzheimer's disease, 1 in 5 for us women, 1 in 10 for men. And in terms of ethnicity, double the risk in older Black Americans, almost double the risk in older Hispanics, and interestingly, less likely in Asian Americans, with Chinese having almost very little risk and Filipinos having a greater risk. But in general, Asians have a lesser risk of developing Alzheimer's disease than us other Americans. Sorry, I just want to make sure didn't miss anything. Okay, so how is it diagnosed? Typically, an individual will go to their primary care physician saying, I've noticed some difficulties in memory. I can't remember conversations that I had earlier today, or I can't remember names. And again, some of this might happen with age, but when it's a little bit more frequent or more severe, like remembering a conversation you just had earlier today, or details of a conversation you had 20 minutes ago, that is not typical. And so typically, patients will go to their primary care physicians, who might refer them to neurology, and neurologists will do an assessment of how the brain is functioning based on some physical symptoms. So if any of you have been to a neurologist, or if you've seen anyone on TV or on YouTube who's had a neurological evaluation, you know, they might have you walk from one side of the hallway to another to assess your balance. They'll have you, right? So they'll have you follow their fingers with your eyes or test your grip strength and things like that. And so they're assessing different functions of the brain through a physical examination, physical neurological examination. There's genetic testing. Some of you might know about biomarkers such as APOE4, which increases your risk of developing Alzheimer's disease. The interesting thing about APOE4 is that it only increases your risk, doesn't mean you will certainly have Alzheimer's disease. And there are also people who don't have biomarkers of APOE4 who will develop Alzheimer's disease later on. So it is informative, but it doesn't mean that you will definitely have Alzheimer's disease. Neuroimaging is also very helpful. There are MRIs, which can show if the brain is shrinking, if it's changing, or it can rule out other reasons why you might be having changes in memory or language. Does the person have a tumor? Have they had a stroke? Is there something else? Are there vascular changes? So MRIs and PET scans are helpful in actually looking at the brain, looking at the pictures of the brain to see if there could be something else other than Alzheimer's disease, or if the shrinkage looks more like the lobes and points more towards Alzheimer's disease. And the neuropsychological assessment, which that's where I come in. And as I mentioned earlier, what we do is actually it's two parts. First, we'll do a clinical interview where we get information from the patient and their family. It's a pretty lengthy interview. It can last up to an hour. And we want to know, what are the concerns? What's changed? What did you do for a living? Do you think you could still do that now? Were you having trouble at work before you retired or before you stopped working? What were the difficulties? What is your level of education? So those kinds of things are important. Have there been any behavioral changes? Is someone being more impulsive or becoming more confused in the evenings, like we talked about sundowning? And so that's part of the first part of the neuropsychological assessment, and the second part is the testing that I spoke about earlier. And it is important to know, I don't think I just mentioned this a little while ago, but when we do neuropsychological assessments, we compare, I did mention this, we compare a person's scores to that of other people their same age and level of education. So remember that dementia is when you have more decline than what's expected for your age. Some important facts to know is that Alzheimer's disease is the 7th leading cause of death in the United States, and it is growing. In, as I just mentioned, in 24 years, it's doubled. So we're seeing more and more individuals being diagnosed with Alzheimer's disease. From the time of diagnosis to death, it can take 3 to 4 years if diagnosed at 80, at the age of 80 or more, and 10 years if diagnosed at a younger age. There are some medications. Some of you may have been aware that over the past couple of years, there's these 2 new medications that came out, and there's some older ones. And unfortunately, Alzheimer's disease is not treatable like any other dementia, as in that it doesn't have a cure. The treatment is really to manage the symptoms or to slow down the process. So what there is out there is the cholinesterase inhibitors, like galantamine, ribastagine, donepezil. They do have other names. You may know them by their other names. The more recent medication that's come out is the lecanemab and donanemab, which are shown to reduce the amyloid plaques, but it doesn't take away the disease because amyloid plaques do come back. The important factor of the treatment is that you start early. So the earlier the better. The sooner you can catch the disease and the sooner you start treatment, the more effective the medications, because you're slowing down the process earlier on in the disease. As the disease progresses, some of the things that we talked about, people start to develop more confusion, having more difficulty recognizing family members, maybe even getting dressed, doing some of their day-to-day abilities, going to the bathroom, and things like that. They're given other medications, and these medications are aimed to kind of give them a little bit more independence, which helps the person with the disease as well as their caregivers who do have a lot of burden on them as well. One of the most common questions I get in my practice, and usually during the second visit when I'm talking to patients about their test results and giving them their diagnosis, is what can I do? So this is where I am, what can I do? And people ask me this even if I told them your scores look good, or if I told them, you know, you have mild cognitive disorder, or yes, there is dementia. They still want to know, what can I do other than medications, right? So the first thing to know is, what are the risks? So we can't prevent it, but there are some things that increase our risk for Alzheimer's disease and other types of dementias. And these are it right here. So family history of dementia is one of them. If you have a family member that has Alzheimer's disease, especially mother or father, there's a higher, and then aunts and uncles and sisters and brothers, there's a higher risk of a person developing dementia or Alzheimer's disease. Traumatic brain injury and brain injuries. So a lot of people in sports that have multiple head injuries, there is a higher risk of developing any kind of dementia, including Alzheimer's disease, Parkinson's disease, as we just mentioned, history of cancer or cancer treatment, stroke, alcohol, depression. A lot of people don't think that depression can affect their cognitive function in the long run. And a lot of my patients kind of leave that, you know, they don't give it that much importance. They hesitate to see a psychiatrist or psychologist and are hoping things will just get better, and or that other things that they're doing will help, but sometimes they don't. And it is important, and one of the things that I like to talk to my patients about is that it is important that they know that, for example, in women, untreated depression doubles the risk of developing dementia. And in men, it quadruples the risk of developing dementia. So it's important to make sure that you treat depression, anxiety, any kind of psychiatric conditions. ADHD, menopause, untreated women who were not placed on hormone treatment replacement have a higher risk of developing dementia. We don't think about how our estrogen or testosterone levels can affect our brain, but actually research shows that women that had a hysterectomy that weren't given hormones for treatment had a higher risk of developing dementia, and low testosterone also increases your risk of developing dementia. And one of the things, I'm kind of getting ahead of myself here, but one of the things that I like to talk to my patients about is diet, because people don't realize how much your diet affects your brain. The reason why I'm bringing this up when talking about testosterone is because sugar has been shown to be very bad for your brain, right? And testosterone is reduced when you eat sugar. And we already talked about how low testosterone can increase your risk for dementia. So think about that when you're choosing the things that you eat. Exercise. When you exercise less than twice a week, it increases your risk for dementia. When you don't engage in regular learning, that can be anything. So teaching a class, right? You have to learn something to teach it. Talking to someone about something that you usually don't talk about. You're learning something new, having different conversations with different people. You're stimulating the brain in different ways. Poorly managed medical conditions, having unmanaged diabetes, high blood pressure, thyroid disease, sleep apnea. This is a big thing. This is a big thing. It is. I have to almost convince and beg patients to use their CPAP machines or go to the doctor and be evaluated for sleep apnea. And it's because people don't realize. So let me start with this. Sleep apnea, that's when you are sleeping and you're not breathing correctly during your sleep. How long do you sleep? Some people sleep 5 hours, some people sleep 8. You're not getting the right amount of oxygen during that time. Your brain is not getting the right amount of oxygen during that time. You're depriving your brain of oxygen. We never want to do that, right? So it's very important to make sure that people are treating their sleep apnea, getting the oxygen to the brain is extremely important. And talking about getting oxygen to the brain, that's why one of the reasons why exercise is important. As we exercise, we're increasing, right, the blood flow to the brain, blood flow and oxygen to the brain. Anything that you can do to increase oxygen and blood flow to the brain is very important. And environmental toxins, so being exposed to carbon monoxide, people that work in, actually, I've heard lots of stories of people that told me that they grew up on farms and in crop fields, and they used to chase after airplanes that would dust the crops. That increases your risk of developing lots of different things, but including dementia. So how do we reduce our risk? Well, some of the things we talked about, right? Exercising, eating healthy, reducing your sugar, which I just mentioned, right? Choosing vegetables, fruit. A lot of the research actually is now showing that, I think we all know, Mediterranean diet is healthy for your heart. And you have to think about this. What's healthy for your heart is healthy for your brain. What's good for your heart is good for your brain. So the Mediterranean diet pushes more towards, eating fish, because, and the reason for that is because fish has omega, which reduces your risk factor for dementia and also just supports the brain, even if you already have dementia. And then eating lots of, like I said, fruits and vegetables, whole grains are also very important. Keeping your brain active, we talked about that, engaging in different conversations, Sudoku, crossword puzzles, card games. I often encourage my patients play card games with your family. You're doing two things there. You're engaging socially, which has also shown to reduce your risk for dementia or slow down the process. And you're also engaging your brain in an activity that is challenging enough that you're stimulating your brain and making new connections or reinforcing the connections that are there. Positive peers. What does that mean? I heard a doctor say once, pick the healthiest person you know and hang out with them as much as possible. Makes sense, because even at any age, right? As we age, we're still influencing each other in different ways. So when you sit next to somebody and they say, no, I'm not going to have this today. Oh, okay. Well, I've noticed you don't have that very often. Yeah, I'm trying to be healthy. Oh, okay. I'm going to be healthy with you too. Or, hey, let's go for a walk together. We encourage each other to be healthier. So try to encourage, you could choose to be that person or find that person that is the healthiest person you know and try to spend as much time with them and gain some of those healthy habits that they have. And I encourage you all to start today to doing some of these things. So if you don't regularly go out for a walk, start today, go out for a walk. I know it's hot, but later in the evening is better, or earlier in the morning, pick your favorite part of those two extremes of the day and go for a walk. Another thing I heard someone say, another physician who's been doing a lot of research on dementia said, walk like you're late. So that doesn't mean like walking around looking at the ants and the flowers, right? If you can, walk at a faster pace, walk like you're late for about 45 minutes, 4 or 5 days a week. If you can't run, if you can't swim, you could do that. So today you could start doing that. Today you could learn something new, or you could decide to pick up a book that you haven't read in a long time, want to start reading again. Learn some, read an article or watch a documentary, although I'm not a fan of TV that much, but something else that's going to stimulate your brain. Choose healthy meals and get your sleep and make sure that you're treating any medical conditions that are not being treated. All right, and that is the end of my presentation. So we'll take some questions. Yeah.
Thank you. That was very enjoyable. Ethnicity, geography, and culture. I grew up and we cooked with Crisco, and everything was fried, cooked excessively. How do you get people to change their generational diet and habits to become healthy and less of a risk for Alzheimer's?
So I'm not a nutritionist, but I have some suggestions, right? Start small. So for example, you want to run a marathon next year. You're not going to start by running a marathon tomorrow, right? You're going to start by walking. You're going to start by walking a little bit faster, maybe jogging, then doing 1 mile, 2 miles. So think about what can you eliminate or change from your diet little by little. And now, so you've done this, what can you do next? You don't eat that many vegetables, okay, maybe you could start adding a few today and having a smoothie tomorrow. And I understand, because I come from a Latin background. We don't eat the healthiest either, right? So it's really just starting, making small, and you know what, I mean, everybody has different mythology of how they like to do things, because some people like to rip off the bandage, right? Like if they're gonna quit smoking, they like to quit smoking, and that's it. Or they like to stop little by little. So if you know what works for you, if it's doing things little by little, you can do that. If it's going cold turkey, you can try that too. I think it'll be more difficult though. You're welcome.
Maybe one more question. Yeah, Zach, what, or after Zach? Or after Tim?
What about the case that I was both at the UCF Medical School? He's been researching Alzheimer's for about 45 years now. He started years ago in Chicago, went to the Mayo Clinic in UCF. 10 years ago, he came up with the cure for this. I say it's a cure because the only thing I've ever seen it actually restores the brain and makes the brain better than it was to begin with. Why it's not in production, I have no idea. I don't understand the culture of the Japanese people and all that. But anyway, you should at least talk to him, make an introduction for you, like to see what he's doing, because his work is pretty astonishing. The other thing is, this is going to bankrupt the entire Western world if we don't do something about it. The cost is already in the trillions of dollars.
Thank you for bringing it up. I was going to add it to my presentation, but I was trying to stay within my time. It is a very big burden on our community, on our country. The caregiver and financial burden is so great. A lot of the services that people with Alzheimer's or any dementia need is not provided by their insurance. And so it's very much out of pocket. And their caregivers have to stop working or have to use all their money just to care for this person now in their family who has dementia. And so we definitely have to do something about it. And even though I want to say they say there's nothing to prevent dementia, because that's what is said, but I am aware of the research that shows there are things that we can do about reducing our risk for dementia, or even slowing down the onset of Alzheimer's disease and any other kind of dementia. And the things I just mentioned are some of those.
Thank you for such an informative presentation.
You're welcome.
You mentioned that there's no cure at the moment for Alzheimer's or dementia, but have you witnessed any sort of cases where you've seen a reduction in severity of symptoms?
I have actually seen some people get a little bit better after starting medications and after changing some of the things that I just mentioned, like using their CPAP machine, exercising, diet. So they're not significant improvements on cognitive testing, but the family tells me that they've noticed some changes. So that is a better indicator, right? Because my tests are just our numbers, but the way that that person is functioning in their day-to-day is a better indicator. And so I have not a lot, but I have seen some patients. Yes.
Awesome. Well, thank you very much.
You're welcome. Thank you for having me. I've really enjoyed my time here with you all.
Thank you. And as a token of our appreciation, we will give you a room mug. So we appreciate that.